Here, come here. Okay. Oh, see, they see my face. Hi, my name is Leanna, and this is my badge. And we are going to perform a head-to-toe assessment today. So before we get started, I am going to pull the curtain to provide patient privacy. And then before we get started in the assessment, I have the patient verify his name and birthday and whether or not you consent to this video for educational and grading purposes?
My name is Christian. I was born in July 10, 1999, and I consent.
Okay, perfect. And then I'm gonna verify that on your wristband. Okay, perfect. And then, so you're here for a post-op tonsillectomy, and then what we're gonna do is we're gonna just perform a head-to-toe assessment on you to see if we can find any abnormal findings. Okay, so I'm gonna start with your head. You're trying to get a good angle, huh? Okay, sorry. So head, no bump, no lump, no abrasion, no thinning of the hair, no bald spot, no lymphatic. And then now I'm gonna check your tempura. Let me know if you feel pain or uncomfortable. Do you feel pain or uncomfortable?
No.
No? Okay, look up at me. We're gonna check your tennis. Pain or uncomfortable?
No.
No? Perfect. And then now I'm gonna check to see if there's any lymph nodes. No lymph node, trach is midline. And then now I'm gonna see if you have any JVD. No jugular vein distensions. And then now I'm gonna check your ears. Tempora is a membrane can be seen and is pearly gray. And then tempora membrane, it can be seen and is pearly gray. Now I'm gonna check your neck. Go ahead and look up at me. I'm gonna check inside your nostril. Okay. Left side is pink and moist with no obstruction. Right side is pink and moist with no obstruction. Go ahead and cover one side of your nose and breathe through it. Okay. Go ahead and do the other side. Okay, no obstruction to breathing. And then so now I'm gonna check your eyes, okay? So the first thing we're gonna do is I'm gonna have you follow the pen light without moving your head. Okay, perfect. And then now I'm gonna shine the light into your eyes, okay? And then this is just to see if your eyes dilate or constrict. Okay, perfect. So eyes, pupil are equal and reactive to light. So eyes are perla. And then your sputum is, there's no deviation and it's midline as well. And then now I'm going to do the whisper test. So I'm gonna cover one side of your ears and then I'm gonna whisper and I just want you to repeat the word.
1.
Perfect.
2.
Perfect. Okay, so now I'm gonna have you shrug your shoulders. And then you're gonna turn your head all the way to that side and then all the way to the other side. Okay, perfect. And then, so now that we have all that done, I'm gonna check your skin bilaterally. So can you put your arms up? And then are you okay with me rolling your sleeves?
No.
So, okay, so for this video purposes, we are gonna pretend that his sleeves are rolled up and I'm gonna check both his skin. Okay, so skin's intact. Okay, skin's intact. And then I'm gonna check your nail for any clipping or stripes. No abnormal finding. No abnormal finding. And then capillary refill is less than 3 seconds. Capillary refill is less than 3 seconds. And then I'm gonna check your pulse bilaterally. So radial pulse is +2 bilaterally. Perfect. Okay, so we have all that done. Let's do your lung sound. Okay, so now I am going to listen to your lungs. Okay. Deep breath in and out. Okay, go ahead and turn that away. Okay, deep breath. Keep taking deep breath. Okay, perfect. Okay, go ahead and turn around. And then, so your lung sounds are, or your thorax is unlabored, symmetric, unlabored breathing and symmetric. And then, so now I am going to listen to your heart sounds. Sorry, I should have just kept them on. Okay, so in this purposes of this video, just for time, the timing, we're just gonna pretend that we're listening to the apical pulse for 60 seconds, okay? Okay. Perfect. So S1 and S2 is present. S3, there's no S3, no S4, no murmur, no galloping. And then now I'm gonna check your feet. So So go ahead and remove your shoes. And then the purpose is we're also gonna pretend that his socks are also removed. And then so we are gonna check the pulse for both feet bilaterally. So pulse is +2 bilaterally. And then I'm gonna check your feet to see the skin's intact and your heel is also pink. And then the other side, skin's intact, heel is pink. And then capillary refill. Capillary refill is less than 3 seconds bilaterally. Okay, go ahead and lay down for me. And then I'm gonna have you wiggle your toes. And then can you flex and extend? Okay, perfect. And then can you lift up your feet? Just one leg at a time. And then go ahead, put it down. And then bend that leg in. And then put it straight out. Perfect. And then we're gonna do the same thing to the other side. Perfect. And then bend it. And then straight out. Perfect. And then now we're gonna pretend that I'm lifting up your pants to see your skin's intact. So this side, skin's intact. And then the other leg, skin's intact. Perfect. And then now I'm going to check your belly. So before we get started, I'm gonna ask you a series of questions. Do you know where you're at?
Yes.
Do you know where are we?
In the hospital.
Do you know what day is it?
Wednesday.
Do you know the president?
Trump.
Okay, perfect. So annual time 4, and then so I'm gonna listen to your bell sound. But before we get started, I'm gonna check to see your skin's intact. Okay, and so we're gonna pretend that we lift up your shirt. Okay, so his shirt is lifted up. There's no distension. Skin's intact, no abrasion, nothing like that. And then so now I'm gonna listen to your bell sounds, and then after we listen to your bell sounds, we're gonna palpate. And then so you just let me know if you feel any pain or discomfort. Okay, so bowel sounds are normal, active, and then now we're gonna palpate. So I'm gonna go in lightly first. You just let me know if you feel any pain or discomfort. Pain or discomfort?
No.
No. Pain or discomfort?
No.
Okay, now I'm gonna go in a little bit deeper. You let me know pain or discomfort? No?
Mm-mm.
No?
No.
Okay, perfect. Okay, go ahead and sit up for me. So we did your lung sound, we did your heart sound, we did your bowel sound. Skin's intact. So now let's do your range of motion. So I'm gonna have you stand all the way up, and then touch your toes, and then walk forward, and then walk back, and then you're gonna move your heels up to the side of your legs. Perfect. And then other side. And then now we're gonna put your arms up, and then now go backwards, and then now go like this. Stand up straight. Go like this, and then now you're gonna push towards me, and then you're gonna pull. And then I'll cross your fingers like this. We're gonna do a grip test. And then go ahead and pull. Okay, perfect. So upper extremity strength is present, lower extremity strength is present. Okay, go ahead and sit down. And then now we are going to check your tonsils. And then go ahead and open your mouth. Okay, so tonsils there, and then it's pink and moist. Do you feel any itchiness?
A little.
Okay, so this is where the patient education comes in. You just had your tonsillectomy, so you are going to feel a little bit of itchiness. So I want you to only drink cold water. No warm water, no hot water, just cold water. Do you have any other questions?
Mm-mm.
Okay, perfect. So patient doesn't have any questions. We are going to lower the bed into the lowest position possible, and then call it within reach. If you have any questions, please reach out to us. And then so this is where I take off my glove and pretend to throw in the trash, and then we are going to perform a hand hygiene. And then that's it.